Good morning. I'm Jennifer Dillaha with the Arkansas Department of Health. And I wanted to kind of give a truth in advertising. I'm no longer the director of the Center for Health Advancement. About 3 years ago, I moved to the office of the director, where I was the special advisor for strategic initiatives. I spent a lot of time working on health literacy, and in April, I became the medical advisor for health literacy and communications. And just a few weeks ago, I also took on a dual role as medical director for the immunization program. So you can bet that the immunization program in Arkansas will have more and more health literacy integration in what we do. I thought that I would start my presentation with a little bit about Arkansas Department of Health. We're very different from Nebraska in that we are completely centralized. We're a unified health department. The main office is in Little Rock, where I work. We have 94 local health units in Arkansas, 75 counties. We have no independent local health departments in Arkansas. Everyone in the local health unit is an employee of the state Arkansas Department of Health. We're divided into 4 centers. The Center for Health Advancement heads most of the health promotion program. That's what I was formerly the director of. And we have a Center for Local Public Health that operates all the local health units, and you can see that we are divided into 5 different regions. A little bit about Arkansas. We have just under 3 million people in our state, and we have a very high poverty rate. We rank about number 5, but just about highest in terms of child poverty, almost 30%. I think it's like 27%. We have a high rate of disability, and we have a low rate of education, and we have low rates of internet usage. We estimate, using the RAND predictive model, that 37% of adults in Arkansas have low health literacy, defined as basic and below basic health literacy. And we rank very low in terms of health status by the United Health Rankings. So I wanted to kind of give an overview of kind of how we came to address health literacy at the Arkansas Department of Health. And I think we can trace it to this presentation that I've taken the cover slide for. As director of the Center for Health Advancement, I became aware that people could not grab a hold of, digest, use the information that was out there. And I kind of floundered around for a while to figure out what this was all about. And then I came across the 2004 Institute of Medicine report on prescription to end confusion. And having digested that report and other literature, gave a presentation on health literacy, which is you see here, and I partnered with the local pediatrician who'd been trained by the AMA in their health literacy efforts. That presentation caused a ripple effect. And over the next year and a half, we would run into people, talk to people, develop friends at other organizations of people also interested in health literacy who were like-minded. And so finally, in July 2009, we decided that we would all get into the same room. We met at the University of Arkansas Cooperative Extensive Services offices, and the meeting was hosted by the Health Department, the Arkansas Literacy Councils, as well as Arkansas Children's Hospital, which had also taken on health literacy as one of their important community benefits goals. The following year, we became a official section in the Arkansas Public Health Association, and that gave us a fiduciary umbrella as well as access to other resources. That year, we invited a certain Mr. Michael Valere to come and give the keynote talk at the Arkansas Public Health Association meeting. In 2008, health literacy was integrated into the strategic map or the strategic plan for the Arkansas Department of Health. This is the current version, which you will see. You can kind of see here that we have health literacy listed as a cross-cutting strategy. It was an important buy-in for all of the leadership at the Arkansas Department of Health. that this is now part of our mission and how we're going to move the state forward in terms of public health. During the period of time after 2009 with that slow ripple effect, I gave a lot of talks. I gave additional talks at Public Health Grand Rounds. I gave a presentation to the Arkansas Geriatric Education Center, which is a HRSA-funded entity in Arkansas. Many strategic planning meetings of different organizations, including the area health education centers in our state, also the federally qualified community health centers. We have something in Arkansas called the Arkansas Aging Initiative. We took our master settlement dollars from the tobacco funds and funded the startup of a network of geriatric clinics around the state. There's about 8 of them, I think, that do training as well as provide clinical care for geriatric patients and do community outreach for the public. I spoke at the Governor's Roundtable on Healthcare, and if you haven't seen the latest copy of the Atlantic, there's an article in there might be interested as the one state where Obamacare seems to be working. But there were many, many others. We spent a lot of time gaining a broad base of information about what health literacy is all about and developing a common understanding. So the health department took this on, and then we began to look at, okay, now how can we move health literacy forward? And you might recognize this from the IOMN report in 2004. So we looked at this. We took this report seriously, and we looked at how can we, in these 3 areas, move the health literacy needle forward. And so I'm going to look at some of these. So the first one is culture and society. One of the things we did is the partnership put on midwinter conferences, which are day-long conferences in January. Our first one was in 2002, and we partnered with the National Network of Library Medicine South Central Region, who came and helped us get a handle on how do you help people get information. So the second one was on education and healthcare working together to address health literacy. And Winston Lawrence from the Literacy Center in New York and Greg Smith from Florida, the Florida Literacy Coalition, came and helped us. And this next January, the focus will be on health literacy among older adults, and we're so pleased that Michael Valere has agreed to come back to Arkansas. All right, now some of the programs in the Arkansas Department of Health took this on and began to integrate it in how they did their planning and how they used their funding. So the chronic disease branch used their CDC funds with the emphasis on how do you empower people to partner with the Arkansas Literacy Councils, and provided them funding through their CDC grant to either begin a new council in counties where there weren't one, to expand them, and to use the Staying Healthy curriculum. And they also used that fund to staff a position that would oversee their health literacy efforts. In addition, the Family Health Branch had several things going on. One is we had coordinated school health that used a K through 12 curriculum, or promoted that curriculum that was specifically designed to advance health literacy. We looked at our home visiting program. We received funding through the Affordable Care Act to implement the Nurse Family Partnership Program, which is the David Olds model, and that is in essence a health literacy intervention. We also received funding to set up the Arkansas Home Visiting Network, so all of the home visiting programs, whether it was the Olds model or others, could work together to address this. And our women's health program worked with HHS Region 6 on the Health Equity Partnership, which was the states in that region working together with women's health, minority health, and family planning to look at health literacy issues in the populations they serve and develop tools that would better meet their needs for family planning. So I want to talk about coordinated school health a little bit. This is a partnership through the Arkansas Department of Health and the Department of Education, but there are many other organizations that are partners in this. The idea behind coordinated school health, even though it was funded by a grant of the same title, it's bigger than just that grant. But the idea was to bring all of the health promotion efforts that people were wanting to do in schools under one coordinating umbrella. And we use a lot of different things, but let me emphasize that health teacher will be available to all of the public health schools in the state next year. It is already available to all of the Catholic schools. We used our National Public Health Improvement Initiative funds through the CDC to implement a plain language project, as well as health literacy research conferences, and to work on our public health accreditation. So our Office of Communications, Health Marketing Communications, implemented a group called the Plain Language Learning Community. This community had members from all the centers, the labs, the representatives that were voluntold to participate in this group, and they learned about plain language and became advocates for that and made recommendations, which we are in the process of implementing now across the agency. We funded health literacy research conferences in 2011 and 2012. Dr. Andrew Pleasant was one of our speakers, and RV Record was also. And this was also funded through a CDC grant. We also used that funding to run the RAND data so that our researchers could have some county level and some census tract level data. We have transitioned the research conference to the UAMS Translational Research Institute that have instituted quarterly grand rounds, research grand rounds. The first one was in July. Terry Davis came and did a presentation, and our last one was last week, and Mike Wolf from Northwestern came. And we're working to implement the Universal Precautions Toolkit around the state. All of the area health education centers have been trained in this. Clinics participating in the Arkansas Chronic Illness Collaborative. Arkansas received funding through CMS as an innovation grant recipient, and the 69 primary care clinics that are participating that receive training in the toolkit, as well as some clinics and staff at UAMS. We're looking forward to implementing it in the 94 local health units, as well as the federally qualified community health centers in Arkansas. All of the members of the Roundtable should have received a round copy. This is the state health assessment and state health improvement plan that are part of the accreditation process. We focused that project on addressing life expectancy, infant mortality, and health literacy. And we tried to use the principles of plain language, although we're kind of new to it, but it's, I think, an improvement over what we might have otherwise done. So, and it's also on our website. We have an Arkansas action plan to improve health literacy. We translated the National Action Plan goals into Arkansas language so that it would mean something to us. But we did not create an elaborate work plan. What we're actually in the process of doing is we are putting on our website, and we're inviting our partners to add their own objectives that we can track over time. So if you go to our website right now, which is phla.net, you won't see much. It'll be there, but there's not much to it. But over time, we are hoping that our partners will add their own objectives, and then it'll be more of a dynamic rolling process. As their objectives are finished, then we'll report on them and add others. And so just in closing, I'd like to talk about some lessons learned about what we could do and what we've learned in Arkansas. It's really very, very important to spend a lot of time talking about what health literacy is. In our report, we really didn't come down with a single definition, but we tried to describe what it is, because everyone has a health literacy story that they can tell you about. We feel that efforts to improve health literacy must be implemented using the current resources. We don't have funding to do things in addition to what we're doing. We need to use the funding to do what we're already doing better through health literacy principles. We need to support our partners and help them reach their goals through partnering with us around health literacy. And that increasing awareness of the problem of low health literacy will not solve it. We must increase the health department's capacity to address it. It's one thing to make people aware that these materials are written at the 16th grade level, but then how do you get them where you need it to go? And then it's important to support the change agents that you partner with, your friends in health literacy around the state. We need people who can operate in their own spheres of influence to affect change and to stimulate new thinking. So I love the idea of a new 2014 report. So thank you.